Well, welcome everyone to NAMI at noon. I'm Amy Brundle. I'm the Marketing and Communications Manager for NAMI North Carolina, and we are so pleased to have everybody here for today's webinar. First of all, as always, we'd like to thank the North Carolina Division of Mental Health, Developmental Disabilities, and Substance Use Services for support of today's webinar. A couple of housekeeping items. If you have any questions for today's panelists, we ask that you put them in the Q&A section down below at the bottom of your screen or use the chat function, and we will answer them towards the end. We'll be sending out any materials, including a recording and a feedback survey, towards the end of the week, so just keep an eye out for that. And now I'm very honored to welcome today's guests. Cheryl Benedetto is the Employee and Engagement Director for the North Carolina Department of Revenue. She leverages her deep understanding of human behavior and organizational development to design and implement strategies that drive employee satisfaction, retention, and performance. She proudly spearheads the DOR's mental health initiatives, and under her leadership, the agency was awarded Mental Health America's Bell Seal certification for workplace mental health at the gold level. And this prestigious recognition makes the DOR the only state agency in North Carolina and one of only four state entities in the entire country to have received this award. And Sarah Boswell holds dual roles at North Carolina Department of Revenue as both Employee Experience Program Coordinator and Agency Mental Health Advocate. And these roles allow her to combine her expertise in employee retention and engagement with her passion for destigmatizing conversations surrounding mental health and substance use disorders, which is so incredibly important. Sarah works to create a positive and compassionate workplace, developing and executing programs that enhance engagement, celebrate milestones, support well-being, and foster a sense of community. And I can't think of two better people to have on this panel about workplace mental health and satisfaction. Welcome to you both.
Thank you so much, Amy. Thank you for that kind and warm introduction. It is really, really great to be here. And thank you to NAMI North Carolina for inviting Sarah and me to be a part of this important conversation. It's truly a privilege for us to be here today. I know that for us, for Sarah, and for me as well, this is a topic of mental health and workplace mental health. It means so much to us, and it means a great deal to me, both personally and professionally. I've seen firsthand how stress, how burnout, how silent struggles can deeply affect the people that we care about. And sometimes that's sort of a quiet struggle, right? So at the North Carolina Department of Revenue, our program is rooted in the simple but powerful idea that when we care for our people, they are better equipped to then care for the work and care for the communities that we serve. So again, I'm really excited to be here to share what we've learned, to share what works well for us. And I am very much looking forward to this discussion. Thank you.
Great. So we'll go ahead and get started. I'll preface this by saying that for NAMI North Carolina, of course, May is Mental Health Awareness Month. That's part of why we're doing this. And we at North Carolina decided that workplace mental health was an issue that maybe we had not drawn enough attention to, that we were going to give special focus on. It is, the levels of burnout, of employee dissatisfaction, and of heightened anxiety in the workplace is just climbing astronomically. And if companies want to address this problem, if they want to, be better advocates for their employees, how do they get started? So that's kind of where our conversation is going to go based on the experiences that you all have had at the DOR. So to get us started today, I want to ask what what prompted your development of an employee wellness program? Like, were you noticing specific things with your employees, or did somebody just wake up one day with, "Hey, we should do this"?
That's a really great question, actually. And so the our decision to create a mental health, mental wellness program, and our program is called the Thrive Together Mental Health Resilience Program. It was actually a very intentional one, so it wasn't something that sort of just happened overnight. We recognized that the work that we do at the Department of Revenue is inherently stressful, right? And our employees are in stressful situations every day. Let's face it, no one likes to pay taxes. So, that those interactions sort of come through. So just doing the day-to-day work can take a toll on employee stress level, on their morale, and again, as you mentioned, on job satisfaction, all of which can lead to burnout and turnover. So we recognized that it was very, very important to pay attention to our employees' mental health and mental well-being. And there are two reasons for that. Number one is that as the primary revenue collection agency in the state, the Department of Revenue is the lifeblood, right? And it funds all the critical public services of the state. So when our employees are mentally well, when they're engaged, when they're productive, then they are more likely to be more efficient at what they do. And the bonus for us is that we are likely to retain our employees as well as attract new talent. But you asked if there was something specific, if we noticed anything specific, and the answer to that is yes. So in 2022, we conducted a stress and flexibility survey, and the results were so eye-opening. 79% of the respondents reported experiencing workplace stress. Alarmingly, 54% of those respondents rated their stress level at a 7 or higher on a 10-point scale. Mm-hmm. And then perhaps most telling, 77% of them said they did not feel like the agency provided them with the resources or the support to mitigate the cause of those workplace stresses. Well, that's all we needed to hear, right? We knew immediately that we had to do something about that because that data isn't just numbers. It's a signal from our employees that we need to do better. It's a signal from our employees that they feel unsupported and they feel overwhelmed. So it became very clear that we had to create this program to focus on and take care of their well-being. So our Thrive Together program is sort of a holistic way of addressing that, and it's sort of a multi-level, multifaceted program. But it's the outward symbol to our employees that not only is their well-being respected, it is protected here at the DOR.
Mm. Yeah, I mean, I think that, if any employers kind of looking around, they could probably notice very similar trends in their companies as well. But kudos for, taking the time to create a survey and really listening to the needs of your employees. Sarah, I'd like to find out from you. I want to find out kind of how the wellness program was built once you all decided to do it. Um, was it done by one person? Was it did it have its one champion, or was it a committee that all gave their ideas?
So initially, it was Cheryl and a coworker from HR who saw the results of the survey and sat down and said, "Okay, we have to do something. So what are we going to do about it?" And at that point, straight out the gate, it was, we need a team. We need more voices. We know that people in the agency do varying work. Like Cheryl said, we collect the taxes, right? But that doesn't negate the impact that our IT people have, that our HR people have. We want to make sure that we're addressing the voices of everyone in the agency. So we knew that the data supported that we needed this program. And so Cheryl immediately said, let's talk to the people. So we kind of cultivated a team of people from varying divisions throughout the agency to make sure that we're taking everyone into account. And it kind of snowballed from there. We definitely had the Secretary of Revenue at the time, Ronald Penny, his support throughout. So he gave Cheryl initially the power to create the team that she knew was going to get the job done. Um, and he was always a huge supporter. Our current secretary is a huge supporter as well. So right now we have 3 employees that do this full time, and then we have our volunteers from throughout the agency to make sure that we're making a pointed effort to hear from everyone, because we know that where our income tax professionals are going to have heightened stress during, March and April, our IT professionals are going to have heightened stress during, upgrades and things like that. And that's going to vary throughout the year. So we want to make sure that we're talking to everyone and, keeping all of that in mind.
Yeah, so you got a variety of perspectives from a variety of employees when designing this program.
Yeah, for sure. We couldn't say that we are for all the employees of the agency. It's the employee experience, and that includes everyone. If we were only tailoring our needs to the people in the phones or the people, in the thick of it, assisting taxpayers every day. So we want to make sure that we're talking to everyone. And sometimes that's surveys, and sometimes that's just conversations. Cheryl and I have worked really, really hard to build trust with our employees. And so we are always listening to everyone. And at this point, we're, making sure that they know that we are a resource for them, that they can turn to us. And so the feedback comes all of the time from everyone,
Mhm.
because it's not a one and done kind of thing. The work that goes into addressing employee mental health is constantly evolving, constantly changing to meet the needs. So
Yeah.
you have to listen to everybody from everywhere.
No, absolutely. And um, it takes all of those employees to build kind of a new aspect of workplace culture, which is what this hopefully ends up being, right? And of course, workplace culture is really built from the top down in a lot of cases. So, Sarah alluded to this a bit, but Cheryl, can you tell us a little bit about what it was like getting buy-in from the leadership?
Ah, so that leadership buy-in is actually one of the keys to our program being a success. We could not be where we are without the support of our leaders. And so one of the very first things that we did to secure that leadership buy-in is to align our mental health program with the agency's strategic priorities. Things like workforce resilience, like growth and development, and employee retention. And so, Amy, because we are an agency of accountants and numbers people, we again leaned on the data to show how mental health impacts performance, how it leads to absenteeism, how it contributes to turnover, but more importantly, how a supportive environment leads to better outcomes. So tying that data to talent outcomes and tying it to strategic outcomes was another way that we were able to gain that leadership buy-in. And what we found is that not only is our leadership very supportive, they've actually become champions, which we couldn't ask for anything more, right?
Hmm.
They're encouraging mental health awareness. They're leading by example. They're talking about their experiences. And it's also so incredibly impactful and encouraging to see that leadership commitment was just not in name only. It wasn't just a symbolic one. It was demonstrated by the resource allocation that was given to us, the time for participation that we received, financial and all of these things. And at the forefront of that was the public acknowledgement from all of them that mental well-being is a priority for us here at the DOR. So when our leaders talk about mental health and when our employees pay attention, then all of our employees feel like they can show up and be their true, authentic selves, regardless of what that looks like.
Mm. Yeah, no, that's awesome because I think for a lot of companies trying to start something like this, getting that leadership to buy not only buy in but also take ownership of that kind of program is a tall ask. And it's amazing that you guys just really got there right off the bat. Um, so okay, we've talked around this, but now I want to hear what the actual elements of the program are. So, Sarah, could you kind of go into a little bit of detail about what you guys are doing?
Of course. So our workplace mental health program is really based on two pillars. And the first is workplace culture. So you can't have a oh, mental health friendly workplace if you have not embedded that into the culture. And one of the first things that we did is we defined that. So again, like Cheryl said, we're, you know, math data driven people. I always work to make sure that they know that mental health is not hugs. Um, it can't be. Don't get me wrong. If you
Hmm.
need a hug, I'll give you a hug. But mental health isn't just, you know, positive vibes and rainbows. There's data that goes into this. We can see why what the work that we're doing has value. And so when we defined what a culture of care looks like at DOR, that really cements it, the work that we're doing. And so we have said that a culture of care at DOR is the systemic implementation of policies and practices and values that support mental health and work life balance at DOR. So just kind of outlining that from the get-go and keeping that in mind. We talk about that all of the time, and that really cements it. And then we put in the work. So one of the things that we're really proud of at DOR is that we have the the state government's only mental health advocate, a dedicated employee whose job it is to make sure that our policies and procedures are supportive of what we're saying, because we don't just want to talk the talk. How are we making sure that we're walking the walk? What are our policies and procedures doing to cement that at our agency? And when their employees have concerns that maybe that isn't happening, they know who to go to. They know who to turn to. That person is me. It's one of my favorite aspects of my job is being that advocate for our employees, but it's more. It's examining our policies and our practices. It's making sure that that is at the forefront of everything that we do at DOR. Um, and we have stay conversations with our employees. I know that we tend to talk to our new hires. Hey, let's send out a new hire survey. What do you think of the agency when you just start? Or we send out exit surveys. Hey, you're leaving. Why is that? And hopefully that's retirement, but you know, that's not always the case. And so what we've implemented is stay conversations. So we're talking to the people who are here every day doing the job and saying, what are we doing that's making you stay? What are we doing that's having you thinking about leaving? What are the things that the culture at DOR is doing to support you here? Or how do we need to still make progress? And so having those stay conversations with our current employees is vital to our program. And then we talk about mental health at onboarding. We have 30 minutes at the first day at the agency where we're going to tell you that this is a priority. This is a priority. You work here now, and your mental health matters to me. And we know that employees don't remember everything at onboarding. They're told a million different things in like a small 6-hour period. So we give them pamphlets and we reinforce that throughout their time at the agency, but we do start from the get-go. The second pillar is training and education. We have a lot of subject matter experts at our agency, some of the smartest minds in state government, in my very biased opinion. And so we know that we have subject matter experts and the best people. But one of the things that makes a good manager, one of the most important things, are those soft skills, that emotional intelligence that a lot of times people forget to train, they forget to educate, or you kind of get happy with the status quo. And so we have a monthly email that goes out. It's on various topics for 2025. It's 12 characteristics of a good leader. And so every month it's kind of a micro learning opportunity of here's a few different resources. If you have 5 minutes, you can do this. But if you know, want to read a whole book on this topic, here's one of those for you. It gives them opportunities to kind of do that self-development, but it helps enable them by providing resources and topics and giving them an opportunity to think about something that they might not have thought about. So we're talking about, you know, self-awareness and compassion, collaboration and integrity, those soft skills. And from our stay conversations, we do some targeted trainings when we are talking to our employees. What are we hearing that needs some work? So from our last round of stay conversations, we heard from some of the leadership that their leadership had told them that they needed to implement one-on-one conversations, which we wholeheartedly support. But it came to light that they didn't know what that looked like. They were just like, okay, so now I talk to my employees once a month. That's great. You know, I kind of talk to them every day, but whatever. So we developed a training that says, no, this is what that opportunity is for. You want to talk to them about where they're at in the agency and where they want to go in the agency and how can you support them in that, and what are the challenges that they're facing in accomplishing those goals, and how can you as a manager help overcome that. Also, reward and recognition. We know that reward and recognition is actually the number 3 reason for turnover. The attrition is impacted by reward and recognition across the board. So what are you currently doing to reward your employees? And I heard in my last round of stay conversations that they don't feel appreciated. So we're implementing some work sessions, and let's just sit and talk about what you're currently doing and what's feasible for you in your division, because we know needs are different. What's feasible for you? And then we've also got constantly, like I said, we're embedding it into the fabric of the agency. So we have every other week, we have webinars from Summerfeld on nutrition and wellness. We do resilience and stress management with our Empower Hour. We have partnered with the University of Phoenix for monthly webinars on some soft skills training. We've had time management, resilience, communication. So it's always in your face. There's always an opportunity, and we're always reminding them that we care.
Yeah, excellent. I think the fact that you were trying to tackle this from so many different angles speaks to your success as well. So I'm curious, like this is where the program is now. But did you in the act of kind of building out what you wanted this program to look like, did you run across any ideas that you tried and they ended up just not sticking for whatever reason?
Um, well, fortunately, we haven't actually had anything that hasn't stuck per se, or we haven't had any projects that we've worked on that weren't a success. But I will say this, we've had quite a few that have not made it off the ground,
Mm.
right? Projects that we're working on that are just sitting in the parking lot. And most of that would be due to resource constraints. We are a state government and resources are at a premium and very limited. So sometimes a lot of that, whether it's funding or staffing or time, that sort of just keeps those ideas on hold, even though we really want to pursue them. Another challenge that I would say that we faced or are still facing is that of participation.
Mm.
So with as much progress as we've made, stigma still shows up, right? It's just this quiet little thing that works itself in. And we see it a lot in the form of hesitance, whether it's hesitance to use a resource or hesitance to attend the sessions that we have. And we really try to focus. We've had mental health forums, we've had just on grief and loss targeted towards specific segments of the population. And I'll give you a good example of hesitance. So one of the things that we introduced is that a quiet room. So there's a quiet room in all of our locations, in all of the 12 offices across the state. And, it's just an opportunity for employees to step away, to decompress, to regroup before being back into the fray, just to give you that little mental break. But they are very much underutilized. Very few, if anyone, uses them. And so I'm not sure if that's because they're concerned about what that looks like on the outside, that I cannot handle the pressure, or what they think that message would communicate. Or maybe they just need another form they just need another outlet. But the quiet rooms are still there, and now we're realizing that we need to change. So culture change takes time. So we really need to work with employees where they are, and that includes building up that trust so that they know it is okay. It is okay to not be okay. It's okay to be where you are. It's okay to acknowledge where you are in the moment, and allow them to do that free of stigma, and allow them to do that without any repercussions. So that is work that we are continuing to do to increase that trust and to build that culture. And so that takes a little bit of reframing and refocusing the conversation to normalize the use of our resources, and to just normalize conversations in general. We've opened the door to start having those conversations. Now we need to make it just an everyday thing that we don't even think about. It's a part of who we are.
Yeah, because I think in a lot of organizations, we're still ingrained in this. If I show weakness, I make myself less viable, less considered for promotion, or, there's a competition element. There's nobody's wanting to admit something that might not give them a leg up over their colleague. And so, yeah, I think you're right that building these kind of cultures takes time, but if we're consistent about it, which it sounds like you all are dedicated to that consistency, then, we all have the hope that that mental health stigma will start to disappear. Um, well, so we've covered kind of, what might not be taking off as quickly as you all would like in your program, but I'm sure you have a plethora of success stories. Sarah, I'd love to hear if you have any examples of how this has turned somebody's view of work around, or if you have any successes to share.
Yeah, of course. I mean, we're so proud of the work that we do, and it's what we're passionate about. So we find so much fulfillment in it. But there are certainly things that are, you know, nice that where it's really reinforced the work that we're doing. You mentioned in our intros that in 2024 we received the Bell Seal for Mental Health America at the gold level, and we were very proud of that. However, we just learned that for 2025, we received it at the platinum level. And what, in case you're not familiar, so the Bell Seal is something where we apply and we tell them what our program is, and they evaluate our program and the work that we're doing in the spaces of mental health for our employees. And then they certify us, hopefully, as a mental health friendly workplace. And so gold was great. But as soon as we got gold, we told ourselves our goal for next year is platinum. There's nowhere to go but up.
Hmm.
And so we recently found that out. We're not sure what that means as far as the stats that you gave in the beginning. Last year, I know we were the only state agency in North Carolina and only the fourth in the country to receive that recognition. But our goal is to kind of set the standard. We don't want to continue to be the only state agency in North
Right.
Carolina. We want to partner with people. We want to work with them. We have another state agency we talk to quite frequently, and we are learning from them and they're learning from us. And we would love to talk to more state agencies because we want state employees, the lifeblood of the state of North Carolina, uh, to know that their mental health matters. But the Bell Seal is something we're really proud of. Another thing that we're really proud of is we have an employee assistance program, and Cheryl and I are responsible for the mental health aspect of our employee assistance program at DOR. And we implemented the availability of that to temp employees, which only one other state agency offers. And we're really proud that we're able to do that for them. But also, our utilization rate is double what most state agencies are. And on the private sector as well, our utilization rate is double. And when we look at the statistics of that, it's not workplace stress, because that we wouldn't brag about. We wouldn't be proud of that. But we can really look and we can see what are people talking about. It's a very confidential process, but we get some statistics, and it's, grief, it's marital stress, it's parenting stress. And our employees are reaching out for help at twice the rate of other state agencies. And that's because we're putting in the work and we're pretty in your face about it. We talk about it a lot. And we're proud of that. We also, through our EAP, we have a crisis response and that is available to us whenever it's needed. So we unfortunately have had to use the crisis response several times due to the death of current employees. And that it's actually not very typical that we lose current employees, and we've actually lost 3 since we implemented this program. So when we're in the offices, when we're talking to these employees, when we're helping people work through this problem, it's awful. It's heart-wrenching. However, knowing that we're providing them resources, knowing that we're giving them the opportunity to seek the help, and talking about it, destigmatizing it. Grief is not something that we all deal with, but it's not something that we should all have to deal with alone. So we bring them together, we put them in the same room. We actually invite families in so that the family can see the impact the employee had on their coworkers, because we're at work 40 hours a week. We want the opportunity to show the impact and how those lives intertwine. And our last loss at the agency, we had invited the family in, and it was actually the last day of an employee she was retiring after 30 years with the agency. And the employee who passed away had been there for 22 years, and they'd worked together the entire time. And obviously this had a profound impact on her, but she told Cheryl and I, in my 30 years at the agency, I've never seen anyone care as much as you guys are showing you care about a loss. And that really cements it for us. There's a reason that we're doing the work that we're doing. And that is something that we're really proud of.
Yeah. Cheryl, what about you? Do you have any success stories to add?
Oh my goodness. Yes, I do. So one of the things that comes to mind, or is top of mind for me, is that this definitely has been a cultural shift since the launch of our program. And I think one of our biggest successes has been the reduction in workplace stress. And that's because employees are learning how to be more resilient, and they're learning how to better handle those challenges. So in the beginning of the session, I talked a little bit about those numbers, right? 79% of employees were experiencing stress and anxiety, and 77% didn't think that the agency supported them. Well, since the implementation of the Thrive Together program, the percentage of employees who are experiencing workplace stress has decreased from 79% to 59%.
Hmm.
And the percentage of employees who don't think that the agency is providing them with adequate support to mitigate the causes of those workplace stressors, that has decreased from 77% to 49%. So that tells me that we are moving the needle and we are moving in the right direction.
Hmm.
And so it's just continuing to build on the foundation that we've laid and to continue to build on that work that we're doing. Another thing is that the Thrive Together program has strengthened the DOR as the employer of choice and strengthened our EVP. So we now position mental well-being and mental health as a core part of why employees choose to work at the DOR, but also why they stay. So that is an incredible thing to have that and to be able to say that, and for prospective employees to respond to that, and for current employees to respond to that as well. And of course, I would be remiss if I didn't say how incredibly proud I am of the team, the Thrive Together team. They are incredible. They are amazing. They're wonderful. They're not enough adjectives to describe just how awesome they are. They spend the time and their passion and their creativity and just how much they care about the employees at the DOR and or community at large. And so it's because of their passion that we've built this movement in the agency, and we have this momentum where we're slowly chipping away at stigma, and we're making the DOR a place where those conversations can be had and employees can feel free to be their authentic selves. So success for me, Amy, is when an employee says, I feel seen, I feel supported, and I feel safe here. And I think we're moving in that direction.
Yeah, and as both of you all were sharing your success stories, I was just struck by how just making sure that you're constantly seeing employees as human beings that life happens to is such a huge part of this. And understanding that we may try to leave our personal lives at the door. We don't always succeed. And we're probably better workers for that, but also those personal lives need tending to. And you guys are doing great work in doing that for your employees and making them be able to be full people at work, which is the dream. Um, so we've heard a lot about y'all's program and how you've been able to kind of get started with the implementation and how, there's still definitely room to keep growing and expanding and moving forward, but it's off to a wonderful start. I want to focus in a little bit now on how employers that might be listening or are interested in kind of, implementing their own program. What are some of the ways that they can apply some of the things that you all have learned in this process? Cheryl, I'd love to hear from you on this.
Yes, of course. So if there's an organization or employer who is thinking about starting a mental health program or really focusing on their employees' well-being, I would say start with where you are, right? So employee feedback is so important, and employee voice is such a gift. So do a pulse check in with your employees, see where they are. And that is a great starting point. And you don't need a huge budget, or you don't need a dedicated division. What you need is that drive and that passion, and you need some consistency. So I start with whatever you have, if it's a small resource, or if it's a small team, or a listening session, whatever it may be. I think what matters most is consistency, as you've mentioned, Amy, and authenticity, right? Because employees can tell when you're doing something that just checks a box versus if you're doing something that is real or something that's performative versus people first. So that consistency and that authenticity is going to be key. And of course, secondly, leadership buy-in. It is so very hard to be a success without it because from the that flows from the top down. So get that leadership buy-in right from the get-go, right at the beginning, and that will be incredibly helpful. And tie those the factors to your strategic direction
Mm.
as well as your talent outcomes. So when you can show that mental health benefits everyone, it benefits the employer, it benefits the employee, it benefits the community, then that is definitely a win-win situation, win-win-win. And it's so hard. How can anyone say no to that? So definitely those two things. Start where you are, do that pulse check, get employee feedback, and definitely that leadership buy-in. Because when your leaders are advocating for you, then that sends a really powerful message across the entire organization.
Mhm. Yeah. Yeah, those are great tips. And I hope that we have some employers listening who are gearing up to get started on their own programs. Um, and then Sarah, we've talked a lot about eradicating stigma, but I wanted to find out just kind of how crucial is that to the success of your program and how you guys hear a little bit more about how you guys are building that into the culture of this program and the culture of the agency.
Yeah, I mean, it's vital, right? If no one's willing to talk to us, if they're not open to having those conversations, it we couldn't do what we do. It requires vulnerability to
Hmm.
talk to us. For us to talk, the reducing the stigma is so important in everything that we do. And so we have mental health and well-being woven into the fabric of the agency, and we are constantly reiterating and in subtle ways even trying to make sure that people know that this is important to us and giving them opportunities to improve their mental health. Things like volunteerism, we're always giving opportunities for volunteerism. We know that that has a positive impact on mental health, and so we're putting that out there. We don't always necessarily tie them together. I'm not always saying volunteer because it's going to be great for you,
Hmm.
but it is. It is. People want to have an opportunity to give back, and we try to provide that. We have opportunities for engagement, all of the things that make us feel connected to each other in the agency. And as human beings, like you said before, it really does. Um, the, I have to look at the agency as a whole, right? When we're talking about those policies and procedures, but the agency is built of humans. So how can we make sure that that human experience is being addressed as well? So we just talk about it and talk about it and talk about it, and
Hmm.
we give them opportunities to talk about it too. And again, we do the leadership development. That's so vital because I'm not always the person talking to your employees. Sometimes that's you. One of the things that we're working on implementing is mental health first aid,
Mm.
because um, I might not be talking to your employees. So mental health first aid, if there's anyone listening that's not aware, is something that it just is really trains people in how to be that front line of defense. So you've noticed that someone, after a loss in the family, they're not acting themselves, or someone who used to come into work super chipper every day and now is coming in and, very much seeming dejected. How do you even open that dialogue? We don't
Mhm.
expect anybody to suddenly overnight become mental health experts or to, be a counselor to their employees. But how do you just even start having that conversation? How do you know what resources are available? So we're trying to implement that for our leaders. Like I said before, reward and recognition is so vital. So it's all of these things that come together to weave into the fabric of the agency. And we do talk at onboarding, like you said. This is something I'm passionate about, and it's more than just, you know, a program. It's about the people. And
Mhm.
I say, it's funny you said it earlier, but I say it every week at onboarding. Um, you can't leave your problems at the door and come to work. That used to be what they said, you know, that used to be what we pushed as a society. It's impossible. And no one is going to just turn off their brain the moment they walk in the door. So, how do we make sure that you're armed with the tools to address those issues? Um, and one of the most important things I think that we do at DOR to address stigma is we talk about our lived experiences. I will tell you all day long about my anxiety. I'll tell you, I'll tell the employees at the agency, I'll tell the cashier at the grocery store, because if there's an opportunity to share in a way that might be impactful for someone, I'm going to do that. I'll talk about my experience with my mom, who was an alcoholic, because the more we talk about this stuff, the more we normalize these conversations. And if we're normalizing the conversation, we give the opportunity to people to talk about it themselves.
Yeah. Yeah. It's down to day-to-day conversations, right? And just making those more comfortable and more normal in just our day-to-day interactions. Um, I'm going to take a few questions from our group here, but first I wanted to let everybody know that NAMI provides a full stigma-free program for anybody hoping to kind of get started in implementing more mental health to their implementing more mental health to their workplaces. So I'm going to put that in the chat right here. Yeah, so if you visit this website, you can find resources for both employers and employees. Um, and you can also sign up to get presentations by people trained to talk about mental health in the workplace. It's a treasure trove. So feel free to check that out as well. So one of our first questions is, are you willing to share the pamphlets that you provide to new hires regarding your program?
So
Absolutely. I'm sorry, go ahead, Sarah.
I was just going to say that what that pamphlet really is, it's a culmination of everything that we do at DOR. So
Hmm.
it's my contact information as mental health advocate. It's the information on our EAP and how to access those resources. It's directions of where to access the information on our website. So it's really just like a one-stop shop resource. And Cheryl can speak to if we are allowed to share that. That's her area of expertise. But it really was just us putting together everything in one spot for a
Hmm.
quick reference guide.
Yeah.
um, Absolutely. So if you can contact me directly, I think it's Diane.
Hmm.
We'll be happy to connect with you.
Okay. That's great. I think hearing the content, so if people want to put something together like that for their own employees, they kind of have an idea of what to include. Um, we have somebody asking what types of specific policies have been added to your handbook that might have to do with mental health.
That's another great question. So the team has come together and reviewed the policies that we have in the agency. And so while or mental health is not a standalone policy, it's seeing how it relates to all the policies that we currently have and how those policies are supporting the culture of care that we're trying to build.
Hmm.
And then working with our executive leadership to, like, right now we have mental health. We have the Bell seal on our or job postings. So that is one way to let everyone know that we are a mental health friendly organization. And so a program or a culture change cannot survive if it is a standalone. And if it's over here by itself, it has to be a part of everything else. So how does this relate to ADA? How does this relate to or flex policy? How does this relate to or telework policy? So it's looking and trying to seamlessly integrate mental health into all of that.
Yeah, that makes sense. We have a question. This person works in a hospital in direct patient care, and their facility has implemented some of the measures that you guys have discussed. However, direct care staff cannot attend because they can't be pulled away from their duties. So she says that clerical and management staff tend to participate, but there's not bedside staff there. Have you found a way to get time-constrained departments the opportunity to participate in your wellness programs?
Yeah, so our call center, we always have to have people available to answer the calls during business hours. And so it's always tricky to get them to be able to participate in anything. And obviously, patient care is a whole different world because, yes, we get angry taxpayers if, the call times are long, but it's not life or death. So one of the ways that we have tried to combat that is we'll have more staff on hand, or we'll plan things during what we know are downtimes. Our call centers are a lot busier on Mondays and Fridays than they are in the middle of the week. So we'll plan things for the middle of the week, and then we'll offer multiple sessions so that they can kind of stagger involvement for their employees. And we listen to the division leadership. I will say, especially for the call centers, I talk to their leadership quite frequently when I know something is coming up, and I'll say, how do we make this work for you? Because I really do want to make sure that your employees can participate. So for that, I would say it might be a circumstance where they need to be talking to your leadership, listening to the voices who are impacted and saying, how can we make this happen for you guys? Because I think that's the first step.
Yeah, I definitely agree with that, Sarah. Having multiple sessions and then staggering the attendance, that has been helpful for us. So that is one of the things. But we also record our sessions. So if employees are on the phones, or if they're out of the office, or for whatever reason, if they're out working at someone else's office, visiting with doing an examination or something of that nature, then they are able to go back and view the recordings at a time and place that is convenient for them.
Yeah, no, sorry, did my headphone just die? Are we good?
A little,
We're
it's
good?
good.
Okay, sorry. All right, so yeah, I think all of that is positive. I also have a question here for those companies that contract with a third-party counseling service as a benefit to the employees. How can managers encourage their direct employees to make use of the service? And you guys referred to a little bit of trying to get employee buy-in as well as leadership buy-in. How can they do this?
Yeah, I think that's, similar to, sorry, Cheryl. That's our EAP, and we just talk about it and talk about it and talk about it. We're very transparent about what the resource is, how you can access it, and yeah, we just talk about it, talk about it, talk about it again. But Cheryl.
I would agree that it's reinforcement with our EAP. We know that some of our employees had that fear around the confidentiality issue and whether or not it will come back at a later date to affect their talent mobility within the agency. So it is continuing to have those conversations and bring in or counselors and accountants or account reps to say, to show transparency of what the process is, and then encourage and show all the different aspects that employees may not know that our EAP has financial counseling and legal counseling, all of these things. So even if you don't necessarily want to use it for this particular issue, it's available for this, and just reinforcing and reinforcing and letting them know what a benefit it is, and it can only be helpful to them.
And I think I have one more question, kind of related. Are there tips for a manager to learn how to approach an employee who might be struggling?
I,
I'll
I
let
would
Sarah take that
say,
one. She is mental health first aid certified.
I would say the willingness to have that conversation is the biggest thing, and being okay with hearing no. Because sometimes they're not ready to talk about it. Sometimes there is the stigma, but I think that consistency and just showing that you care. I love the phrase, "Hey, I've noticed something different about you. Is that something you want to talk about?" And then that opens it up. It's not negative necessarily. Different is different. Um, so if there's a specific concern, if it's impacting their work, making sure that you're phrasing it in a way that is person first, because they're the priority. You have to make it sound like, you know, I've seen that your work quality has declined, and I'm worried that there's something going on that, you are experiencing struggles. Do you want to talk about that? Don't put the focus on the work aspect of things. That can be what is making you notice something's going on. But the person first mentality, I think, is really a way to go. And know your limits. Go to them and say, "Hey, I am concerned about you. Do you want me to help you find some resources?" You don't have to say, "I know everything straight out the gate. I know exactly what we're going to do to solve these problems." But just the willingness to listen. And if you do have something like an EAP, just saying, "Hey, this is something you might want to consider," or, that's an easy way to reach out. And it destigmatizes those conversations. You're willing to have that conversation. You're telling them it's okay to access the EAP, but you don't have to be the subject matter expert.
And I think that's why the training for managers is so essential, to help them along the lines of emotional intelligence and just to be able to notice what is happening with their employees. So if you're a manager who's work focused today, and then tomorrow you sort of try to hone in on that conversation, it may not necessarily go in the direction that you're hoping it will. It's putting our employees first, and that consistency of working to let employees know that this is the culture we're building, where we see them, we acknowledge what they're going through, and we will help them to get to where they're trying to go. And yes, the work is important, it's critically important, but we're going to blend those two things together.
Well, I think we've reached about the end of our time today, although I'm sure we could talk about this for another hour. Do you guys have any closing remarks, any takeaways for our audience today?
Oh my goodness. Well, first of all, again, Amy, thank you for having Sarah and me. This conversation is just so important. What I would like for our audience to take away from the experience that we were creating at the DOR is, again, it doesn't require a huge step in the beginning, right? We don't have all the answers, or team doesn't. And you don't necessarily need that big budget. You need to have a will to listen, and to lead with empathy, and to lead with compassion, and to then follow up with that, and act with intention. So make it visible. Don't just relegate it to one time of the year. Just make sure that it's interwoven and it's consistency, and that will bear fruit.
Yeah. Well, I'm going to give a hearty thank you to both of you for giving up your time and coming in and telling us about your amazing award-winning program. Congratulations on the platinum level. That's amazing. Um, I'm going to put our helpline information in the chat here. So just a reminder that, you know, if you're also looking for other mental health resources for you or a family member, we are available Monday through Friday, 8:30 to 5, and then Thursdays we actually stay late until 8:30 p.m. So the information is there. Also, keep an eye out for an email by Friday afternoon with a copy of this recording and a feedback survey. We would love to get your feedback on this panel so that we can plan similar ones like it and other sessions later on in the year. And then keep an eye out for information about our next NAMI at noon, most likely happening in June, but that information will be out shortly. Again, a huge thank you to Cheryl and Sarah for giving up their time. And a thank you to everybody who dialed on and listened today. We really appreciate everybody being here and their support of this program. Until then, until we see you next time, have an incredible afternoon. Thank you all so much.
Thank you.